From the southeastern corner of western North Carolina, this is Folklore. I'm your host, James Hernishan. In the history of civilization, few inventions have made as big a difference to the quality and quantity of life that humans now enjoy than vaccination. Along with indoor plumbing and understanding the need for surgeons to wash their hands between operations, vaccines are right up there. They're free, safe, and effective. They can also protect you not just from the disease they were designed to combat, but other hobbling conditions like Alzheimer's and dementia. Before vaccines, your chances of surviving past the age of 5 was less than 50%. And one of the most effective vaccines is the one against measles, which was declared effectively eliminated in the US in the last year of the last century. So why then, in 2026, are we seeing the largest outbreak of measles in a very long time just across the Carolina border in Spartanburg County? As I record this, the number of cases of measles there is approaching 1,000. Before that, a typical measles count for the entire country in most years would be in the low hundreds. It's tempting to blame the current federal administration, which has shortened the list of recommended vaccines and promoted bogus alternative treatments. The Secretary of Health, Robert F. Kennedy Jr., has practically launched a crusade against vaccines, and the one that protects against measles in particular. But the truth is, vaccine hesitancy, as some call it, has been on the rise since before the current government took office. Maybe it has something to do with the politicization of the COVID vaccine, which, despite saving millions of lives, was saddled with a host of bizarre conspiracy theories. And it's not just a problem in this country. Both Canada and the UK have just lost their measles-free status too. Whatever the cause, the proportion of people who are properly vaccinated is dropping, including, as you'll hear, in Polk County. And given the threat posed by 1,000 cases on our doorstep, I wanted to find out how our county's health department was responding to both the change in public attitudes and the outbreak itself. Natalie Trachsel, who is the current health director for the county, and Elizabeth Burnett, a nurse with the health department, agreed that it would be a good idea to share what they've been doing and what everyone else in the county should be doing too. We talked on February 19th at the department's office on Highway 108.
Natalie Trachsel, Elizabeth Burnett, welcome to Folklore.
Thank you. Thanks for having us.
This, I think, is one of the more important episodes I've ever done because this is about people's lives, right? Measles is not fatal in most cases, but it can be, and it can have all kinds of negative consequences for basically anyone, but children in particular. So let's start off by talking about the current situation and what is the state of measles outbreak in our part of the world.
Natalie, why don't you start?
Sure. The measles, of course, we're talking about it because the measles has begun to spread. We haven't seen a spread to this degree in the United States since the early 2000s, if not earlier. Right now, the biggest outbreak in the United States is in Spartanburg County, which is just our neighbor to the south. So fortunately, in Polk County, we've only had 5 cases so far. I say only. We never wanted to have any cases, but we've had 5 cases so far. Spartanburg County is over 900 cases. So we know that it is spreading. We've taken measures in the county to prevent the spread. And so far, there is no established community spread, but it exists and it's continuing across the state.
Okay, can you define community spread?
I would like to reference the state definition if that's okay.
Yeah.
Community spread is defined by the state as in an area where person-to-person spread of measles in the community is known or suspected to have occurred. So with our cases so far, we've seen individuals contract measles from specific locations, mostly in Spartanburg County. So far, we're linked to the Spartanburg County outbreak, but there haven't been established instances of spread between Polk County citizens. So that's the difference there.
Okay, I think it's a really important one to know that although Spartanburg has got a real problem, it clearly hasn't surpassed the threshold in Polk County where you got to be worried about people that you meet in Polk County, all right? Who's most at risk
As you mentioned earlier, children are the most at risk, especially babies who haven't had the chance to be vaccinated yet. The first measles vaccine is recommended around 12 months, between 6 and 12 months. In some instances, it's recommended earlier, but most babies haven't been vaccinated by the time they're 6 months old. Also, pregnant people and people who are considered immunocompromised, like people on chemotherapy or with illnesses that kind of suppress their immune system, they're especially vulnerable to the measles as well.
I think it's really important to talk about the fact that there's a lot of not a lot, but there are some people who will not get the vaccine or again, they're too young to get it because those of us who are vaccinated, we walk around as if, well, it doesn't really matter because I'm not going to get it. But it can be spread to people who don't have it,
Right.
right? The whole point of vaccination is most people in the community have to have it in order for the vaccine to be effective at keeping the disease at bay, right? Do you encounter any resistance to that message?
I think we do see some uncertainty about vaccine safety generally, and with the measles too. Concerns about safety, concerns about necessity of vaccination. I think one, the concern is warranted. There's always been a lot of information circulating about vaccines, what's in them, why are they necessary? But especially recently, there's since COVID-19, um, what's considered new vaccination, it kind of a lot of information can just cause some confusion on what to believe, what's most important. So we do see that. We see as well, I think sometimes this vaccination conversation comes down to a conflict between individual choice and community responsibility. And public health kind of sits at the intersection of both. We do really value independent decision making and autonomy in decision making. You have the right to receive all the information and make your decision. At the same time, public health is about the public's health. So, of course, vaccines can protect an individual, but like you mentioned, vaccination also serves to benefit the general public for people who can't be vaccinated or people who have been vaccinated but have since become immunosuppressed if they're on chemotherapy, like I mentioned. There's that question of whether we're also responsible for looking out for them. They can't make that decision to be vaccinated. We can, so we can serve to benefit those individuals as well by preventing spread. Unfortunately, as you mentioned, a certain threshold needs to be met to prevent community spread. It's usually at about 95% of people need to be vaccinated. We're not at that rate in Polk County currently. As of 2024, about 84% of kindergartners documented at the state level were up to date on their vaccines, like the measles vaccine. That data is potentially a little bit skewed because there are some schools that aren't reported, and of course, that's from 2024. But even small gaps in vaccination, taking us just below the recommended threshold, can introduce kind of pockets for measles to transmit.
Yeah, I think a lot of people, when they hear 95% is the goal and 84% is what we have, that sounds pretty close on a scale of 1 to 100. But the truth is, that's kind of a fair gap. And it probably didn't used to be that big. I know in the early days of COVID, I did some research and the numbers in the schools were actually pretty good at the beginning of COVID era. We had like near 100% in Saluda, for instance. So 84% is actually probably something we should be trying to improve, right?
Yes. It's important to note that measles is one of the most contagious diseases we've ever seen. In a room of 10 people who are not immune, either they haven't had the vaccine or they've never had measles in the past, so they don't have any form of immunity. If someone walks in with the measles, statistically, 9 out of 10 people in that room are going to get it. And measles can live in the air for up to 2 hours. So when we see an exposure in a public location, for example, a school, we've got kids going all around the school, sharing the same hallways, the same cafeteria. So one person, bathrooms, as Elizabeth mentioned, one person with measles in the school can expose the entire school in an instant because chances are all those people are going to pass through those same public spaces within the 2-hour time frame, and that actually extends sometimes beyond that time frame. So there's just a higher risk than I think people give the measles credit for. Unfortunately, it's so highly contagious. It's just important to keep in mind when considering what it really means to have the measles present in the community.
So other than getting your shots when you should, what does an individual resident of Polk County, what should they be doing? What should they be thinking about? What kind of action should they be taking?
I think vaccination is the number one recommendation. It's evidence-based, it's safe. I I heard Elizabeth take a breath.
Well,
We have something.
it's effective. I mean, we saw over the past, several decades how the measles number had decreased, or we hadn't seen. Let me go back. We saw, maybe 100 cases in the U.S. decades ago, maybe 100, and those were typically brought in through international travel. And so to see a spread this at this volume is profound. And so we know that with the vaccination rates declining and increasing number of measles, that counterbalance is recognized. And
If someone thinks they might have been exposed, what should they do?
That's a good question. As I mentioned, measles is highly contagious. Unfortunately, with the measles too, something that's important to mention that kind of speaks to your previous question is the measles, when someone contracts the measles, they don't have a rash on day one. We think of the measles as the rash, the maculopapular rash is what they call it, just the kind of raised red bunch and red bumps and splotchiness. But typically, a person is infectious 4 days before the rash appears on them. And their symptoms in those 4 days before look a lot like symptoms that you would have from the flu or from COVID. There's the runny nose, there's the fever, watery eyes, sometimes, or cough. All those symptoms accompany a measles infection. So that's important to know, first of all, that you can be spreading the measles without even knowing it. And especially with the flu rates that we saw in this past season, we don't imagine it to be uncommon that people would assume they have the flu and could potentially have the measles. But if someone is seeing those symptoms arise, they start to see that rash, or even before then, they are just concerned they might have been exposed to measles, or they know they've been exposed because the health department told them, which we've had to do so far. We've had a couple of public exposures. It's important that the individual stay home and call their healthcare provider before going in for care. Because it is so contagious, we don't want to expose anybody else further. So we've worked with our providers in the area to make sure there are arrangements set to be able to serve people coming in who may have been exposed to measles without them exposing the rest of the public who are present in that space. And then just staying tuned for guidance from providers and from the health department regarding next steps. It really depends on someone's immune status, what happens after they've been exposed. Of course, we want to get them into a provider to test them for the measles to see if they do indeed have it, or if they're immune, if they're not sure. But if someone's not immune, that can take you down a different path than someone who has been vaccinated and is exposed. If you've been vaccinated, especially if you're fully vaccinated and you're exposed, you're pretty much good to go. We'll still do a consultation with the health department just to make sure we're checking in. You haven't seen any symptoms. You don't work in what might be considered a high-risk setting. There may be considerations there, but generally, vaccination is kind of your get-by-free pass.
We should just suggest that the first thing everybody should do is make sure they're up to speed on their vaccine
Definitely.
schedule, right?
Yes.
Yeah. And so if you have, say you've got some kids and they've been down in Spartanburg, and think they might have been exposed because they're coming down with some symptoms, what's involved in a test? Is it like a COVID test?
It depends. There are a couple different tests that they'll perform. I don't know if Elizabeth wants to speak to it because she's been in kind of the testing setting and helping providers. Yeah.
typically the best way, the first measure would typically be a PCR test. So that was similar to like a flu test, which is a swab that goes up the nostril. We also can do urine to test for measles. And these tests also, I may mention, depend on the timing of syndrome or of symptoms as well. And there's also blood tests, but you need to do those in tandem with one another. So a PCR would want to be done with a urine, and or blood. So those things run together typically. And I will say that if a person is exposed and they are notified that they are exposed, typically we don't initiate testing unless there's that rash that comes and appears. So that's a rash that starts near the hairline and works its way downwards. So that was when we would initiate testing.
Okay. And if someone is positive for measles, what should they do?
So if someone is positive for measles, you of course want to stay home. You don't want to have, anybody coming in the home. You need to, of course, in your household be aware of the immune status of others. And typically you're gonna need to kind of monitor those symptoms because there are complications of measles that a lot of people don't just, we don't talk about a lot. And so watching for those things and being certain that you are not impacting other individuals during that 4-day period. Typically rash is day 0, and then 5 days, or the 4 days that follow that rash are when you are infectious.
Treating measles. I suspect for the vast majority of cases, you just got to suffer through it, right?
Yeah, unfortunately, there's not a set treatment for measles. It's usually treating the symptoms. But you kind of have to ride out an infection.
So obviously alternating with Tylenol and ibuprofen if as needed, hydrating, because we know that diarrhea is something that we see a lot with this type of infection. So, and rest, and keeping monitoring the beavers, of course.
Okay. So that's, I think that takes care of what individual residents should do. What are you doing? I mean, how do your responsibilities work into responding to the fact that next door we have one of the biggest outbreaks in this century?
Natalie?
Sure. Public health is all about prevention. That's one of our central components. So we tried to be really proactive when we heard that there was just one measles case far away back in the winter and spring of 2025. We started taking steps to make sure that we as a health department would be prepared and that our providing partners would be prepared. So that ranged from doing an exercise to simulate, oh, wow, we have a bunch of measles cases in the county, which at that point, there weren't even cases in South Carolina. But if we were to get all these cases, what are we doing? How are we aligning our communications to make sure everybody's in the loop, including our partners and also the community? How are we making the community aware of what they need to be doing? Do we need to go on a podcast? um, that we also included provider training because measles is making a comeback in a big way for the first time in a long time. Some young providers have never really seen it in person. So that was a discussion that we had with our medical director. We partner with Blue Ridge Health and Polk to do our clinical services. And he mentioned, providers might not know what they're looking at. So we developed a training to identify what measles looks like on different skin tones. What are we doing to test? How are we reporting cases? Reporting is a really big component of public health to make sure we are keeping tabs on the trends in measles spread and communicable disease spread in general. So there was a lot of preparation that took place all throughout 2025. We developed a communications plan with our county public information officer. We trained providers. We worked with long-term care facilities like nursing homes to make sure that they would have a plan if they would have cases in their complexes. We talked with the schools. We really tried to get ahead. And then once we saw our first measles case, it was really about cracking down to prevent the spread going forward. So that looked like making sure we could identify quickly that person's immune status, making sure they were staying home for the respective amount of time that was necessary. As Elizabeth mentioned, once someone is diagnosed with measles, they have to stay home 4 days after the rash appears. So rash is day 0, 4 days later, they should still be in the home. And we were really quick to work with the state as well to make sure that we were taking measures to prevent spread outside of the county. Thankfully, we haven't seen it, and I think that our measures have been effective. But yeah, public health has been really heavily involved from the preparation side and the response side. Elizabeth and our other nurse went to local providers and helped them to kind of practice testing as well and make sure they had the supplies that they needed. So there was a lot that went into it. But I think in concerns of communicable disease, public health is pretty central with the prevention and promoting healthy behaviors as well.
So you had a lot of your ducks in a row before the numbers in Spartanburg County got really out of control?
That was our intention. We tried our best, yes.
And so we had 5 cases in Polk County. Were those mostly kids?
We can't disclose that information.
Okay. I wasn't asking for names, but I was talking to a teacher who said there was a couple of cases in her school. So
Yeah, I'm
okay.
hesitant to
give out demographics
just because
or anything. Yeah.
our number is so small. I don't want to, do it.
Statistically, it's not a very useful number because 5 out of 20,000 people.
Right.
So yeah.
Right. No, we
We
understand.
can say that at the state level, kids have been involved. Similar to trends at the CDC, a lot of cases, the majority of cases are in youth and young adults.
Right. When you do identify a case, what steps are taken? What professionals are brought in, and what resources are brought to bear?
So once someone is told they need to stay home for the respective amount of time, whether they're a case or an exposure and they're not immune, so they have to stay at home, we worked with several county partners to make sure that people's needs were met at home because, of course, staying at home means you're going to miss work or school. So the schools, we worked ahead of time with them to make sure there were preparations in place. Maybe their work needed to be brought home to them or arrangements were made with would be made with those individual families as impacted. But we also worked with Thermal Belt Outreach to make sure that there would be food options. And we worked with our community paramedic program so they could help us with food deliveries to those individuals. If a whole family were to be impacted, for example, they couldn't go to work or school, they just had to stay home. We could organize food delivery, and our community paramedic could also check in periodically throughout their stay-at-home stint to make sure that their symptoms weren't progressing and there were no urgent medical needs that needed to be attended to as well.
So it sounds to me like if you get measles, you're supposed to be quarantined, but you're not alone. There's a whole network set up to make sure that you don't spread it and you get what you need to get through it.
Right.
Well, is there anything else the people need to understand? I mean, one thing we didn't touch on, and maybe I'll put this in my intro, but measles is not like the world's worst disease. It is one of the most contagious, but you're not going to, the likelihood that you're going to die is not that high, right? But it's still a problem. And I mean, this is where I think a lot of the lack of interest in vaccination comes from, because they say, well, people don't die from measles, but people do die from measles. It's just not a huge proportion of the infected.
Right. I think, yeah, speaking to the consequences of measles, the direct infection may not produce any consequences in the short term. As you mentioned, it's kind of, the rash feels maybe like a worse version of the flu, and hopefully they make it through that. Something that's different about the measles is you're kind of highlighting these long-term consequences that maybe we don't think of as often. People can get pneumonia. People can get brain swelling or encephalitis that leads to other complications, especially in kids, like vision loss or hearing loss. Something else that science points to is what's sometimes referred to as immune amnesia. So essentially, your immune system can be wiped to an extent after one infection with measles. This happens too with diseases like HIV. The disease through infection, especially for HIV in the long term, after many years, 5 to 10 years of untreated HIV, your immune system can kind of lose its memory. Your antibody levels start to decrease, which makes you vulnerable to diseases that you may have been immune to in the past. Measles does in one infection what HIV does to the immune system over 5 to 10 years of no treatment. So that's something that I think isn't talked about a lot, but that's where some complications can come in. Is someone may be immune to all kinds of diseases. They contract the measles, and after one infection, their immune system can essentially lose some of its warriors. A study was done by a Harvard physician back, I think, in 2019, that in a sample of children with measles, their antibody levels decreased between 30 and 40% just across the board. So it's like if you had a football team with 11 defensive players, 3 or 4 of those players are just dropping off the field, and you're now vulnerable to all kinds of infections that you thought you were no longer vulnerable to. So that's where those long-term complications can come in. Maybe you get through that initial infection, but then you're susceptible to, as we
Something
mentioned,
worse.
something worse, pneumonia, encephalitis, or whatever it might be. So that it is a risk. Children do have the opportunity, if they contract the measles, to rebuild their immunity over time, but that can take years. So it's still definitely a risk. And the good thing about vaccination, again, just getting back to what we really push for, what the evidence pushes for, is vaccination makes it so that you don't have to go through this period of infection and then vulnerability to new infection. It's just a safe way to have your defensive team, ready on guard off the bat.
All right. Well, I think that covers it. I would like to hope that there aren't that many people out there who are vaccine hesitant, but the part of the world we live in, there are some folks. And thanks for giving them the information they need to make this decision.
Absolutely. Thanks for having us. We definitely understand that there's hesitation with any kind of medical treatment, vaccination. If we're not physicians, what do we know? So it's important, I think, from our perspective, just to keep an open mind to hearing what experts have to say, finding a physician that you trust and talking to them about your specific situation, and then going from there. We exist just to support people in living healthy lives, and we didn't want to have to confront measles, but now we are. So we just want to make sure that people have what they need to make healthy decisions for themselves and their families.
All right. Well, thanks for doing that. And thanks for doing this episode.
Thank you.
All I can add to that discussion is a plea to those who are still skeptical of the risk-benefit ratio of vaccines. If you've gotten all the way to the end of this episode, you're probably already on the right track, which is to put your trust in those who have devoted their lives to saving yours. If you're still uncertain, though, give the Polk Health folks a call. That's what they're there for. And take a look at the resources in the show notes. As always, you can send me your feedback and suggestions by emailing them to jamesh@polklore.com. Thanks for listening, stay safe, and stay healthy.